Half a day and good evening. Thank you so much for joining us today here at the Hilton Guam Resort and Spa for a very important information meeting. I'm going to go ahead and make sure our live stream event is working for our colleagues who are unable to join us. For those who have colleagues who are unable to join us, you can encourage them to tune in live on facebook.com/govluguam. For those of you who don't know me, my name is Krystal Paco-San Agustin. I'm the Director of Communications at the Office of the Governor of Guam, and I've gone ahead and condensed the presentations we've been giving to the public to a very bite-sized Cliff Notes version for tonight's discussion. And before I introduce our Governor Guerrero for her remarks, I wanted to familiarize you with the panel we do have up here, led by Guam Economic Development Authority Administrator, Ms. Mendiola. Yes, you can give a round of applause. To her right, we have Mr. Joseph Borja, the Department of Land Management, our director here. And rounding out our panel, we have the Guam Ancestral Lands Commission Director. He's also the Acting Director for the Chamorro Land Trust Commission. And now I want to give the floor to our Governor, Guerrero, for her opening remarks.
Thank you very much, Krystal. First, I want to wish every one of you a happy Thanksgiving and happy holidays if I don't see you before Christmas, and enjoy your holidays. I want to also thank you for taking the time out to come and see our presentation about the vision that we have to provide healthcare services to our people. Just a real quick history and how we're going to do this is after I speak, Krystal will give her presentation. It's probably not going to take any more than 20 minutes. And then I'd like more of a question and answer opportunity because there may be questions that you have that is not addressed with the presentation. So, quick history about healthcare in Guam. You know, since 1898, if you want to go back, we had our own traditional practice of medicine. And then, of course, Spaniards came in, and then the practice of medicine started changing. And then, of course, you had during the U.S. government time, after 1898, when we were given over to the U.S., we had naval hospital, naval government medical care, free to the island of Guam. And then the war came in. There was not any means at all of any kind of healthcare delivery system, only that there was a civilian Chamorro doctor that was allowed to transport and to travel freely among the civilians for healthcare. I know this because that civilian doctor is my grandmother's brother, Dr. Ramon Sablan, the very first Chamorro doctor. And as a result of that, he was able to provide healthcare. And then, of course, the U.S. came back and liberated us. And now again, we went back into naval government healthcare delivery system until 1950, when we signed the Organic Act and the responsibility of healthcare was given back to the civilians. That's when we started running our own healthcare delivery system. Just a few notes to highlight. The old GMH, the one that was demolished on Ipao Point, that was built by the naval government for the people of Guam. After years of existence, it then started deteriorating. And leaders at that time started looking for another place for the hospital. There's been debates and discussions. The legislature at that time wanted the hospital in Chalampago. The Board of Trustees of the hospital wanted it at Ipao, next to the old hospital. Well, none of that materialized because in the meantime, the Archdiocese of Guam built the Medical Center of the Marianas. They didn't do very well financially, and GMH needed a new hospital, prime kind of opportunity. So what happened is the federal government gave the governor of Guam $25 million and purchased the medical center of the Marianas, which then became the Guam Memorial Hospital. That's the existing Guam Memorial Hospital now. Here we are 50 years later. It's no longer adequate for our people, and we are again doing this debate about building a new hospital and what's the best site for that hospital. So that brings us to current now. And I'll give this over to Krystal so she can start her presentation, and then we'll have questions and answer period. I want to give a lot of time for you guys to dialogue and get answers of your concerns.
Thank you so much, Governor. Like Governor said, this presentation is basically a synopsis of cliff notes, if you will, of the presentations we've been providing to the public. It combines the presentations from our Guam Economic Development Authority, Department of Land Management, and Guam's Ancestral Lands Commission. So I've titled this presentation, Say Yes to a Guam Medical Complex Built in Barrigada, Mangilao area. And I say that because I don't think anyone in this room can dispute that we need a new hospital. The debate now has evolved into, do we need a hospital or do we need a medical complex? So as a communicator, I find that the most effective way to communicate is to present the facts in a simple way. Who, what, where, when, why, and how. And as doctors, I know that this is how you operate as well. You see your patient, you make the diagnosis, you look for the symptoms. And so that's how I wanted to dissect this presentation for you. So who are we talking about? A Guam medical complex is not a new idea. If you're tuning into the Guam legislature, which I hope you are, but I know your busy schedules probably don't allow you to, they've been talking a lot about the medical complex. This vision actually started in the 60s, 1969 to 1971. The 10th Guam legislature, back then they called it the Guam Health Care Center. And then later on it would come up again in the GMH planning study. So this has come a long way. It also circulated the idea of a medical complex. Came back in the 18th Guam legislature. Fast forward to today, we're in the 37th Guam legislature, and we still have just a hospital. But who are we talking about? You're all familiar with the Guam Memorial Hospital, the island's only public hospital since 1956, but actually 1946 if you call the Quonset Huts a hospital, formerly at Epow Point. Very symbolic that we're here this evening. We're right next door to Epow Point. And then at Oka Point, which we're all familiar with today. 4 stories tall, concrete framed, flat roofing, and according to the Army Corps of Engineers, certainly approaching the end of its serviceable life cycle. So we all in this room know that right now we're just putting Band-Aid fixes on GMH and that we all need a new hospital. It's a licensed 161-bed acute care hospital. You all know the services they provide: outpatient care, urgent care, emergency care, and the SNU, of course, with our long-term care with those 40 beds. But who is GMH today? We talk a lot about size and the growth and Guam's growing population. So let's look quick at the numbers. 15.6 acres. That provides for 481 parking stalls, because I know a lot of the people of Guam, yourselves included probably, have complaints about the parking facilities at GMH. The 481 stalls service 1,200 employees, providers, patients, and visitors. Recently, I think it was sometime last year, we demolished the Z Wing, our oldest part of the hospital. You can see a quick timeline of how many renovations we've seen in the last few years. 1978, the buildings were constructed. 1989, renovations to add wings. And most recently, in 2014, they expanded the ER, the critical care unit, and the ICU. So who would be included in this vision for a medical complex? First and foremost, the Guam Memorial Hospital. We know that's the most pressing need. And then these other facilities would follow. I wanted to note some important facts. Public health, currently no public health center in the central area. So there's no public health in Mangilao. We know that there was an electrical fire several years ago. We've not returned back. So we do have public health in the north, in the south, but none in the central. The Guam Behavioral Health and Wellness Center, it's already co-located with the Guam Memorial Hospital in Tumuning at Oka, but currently there are no options for inpatient stay for clients who need medical care. Then to follow, a veterans clinic. For those of you medical providers who provide for our veterans, you know that there are many complaints about the CBOC. For those listening on Facebook and don't know what CBOC is, that's the community-based outpatient clinic. So in the last few weeks, you've heard a lot from our veterans who have had many frustrations about the quality of care and the limited care they're able to get on Guam. And part of that is that the CBOC can't expand. The CBOC is currently located right outside Naval Hospital. They can't grow. So part of the issues there, limited providers, there's a high turnover of providers, and the veterans are forced to travel off island, often to Hawaii. That's an 8-hour flight, a $2,000 plane ticket, and then wait times for prescriptions via mail. The pharmacy, also, that would be part of the medical complex. I don't have to tell our doctors and our nurses why it's important to take your medicine. And specialty care clinics. Again, we want to draw specialists to Guam. And then, of course, our medical providers' offices, because sometimes when you see a doctor, you also need to see your provider to get more information about what your coverage is. This next slide is actually an early conceptual plan. This was for Eagles Field. But as you can see, lots of parking. This fan layout provides for ample parking, lots of services, our hospital facilities, the lab, co-located. Also, physical plant and substation. We all remember what it was like during the typhoon. We had to get power and water restored to GMH as soon as possible. Lives depended on it. But what happened? So we did the who. We know who the who is. What? In 2019, that was the year our governor, who is also a registered nurse, took office. She asked USDOI, Department of Interior, and the Army Corps to come to Guam, do a facility assessment. They spent a few weeks on island, and this is what they found. But I want to preface this report with the fact that they only captured a moment in time for GMH. And this was a moment in time before the pandemic, before GMH took the wear and tear of the pandemic, and before Typhoon Mawar. That report was released in April 2020. Here's one of the interesting quotes from that report. The current facility is in overall state of failure due to age, environmental exposure, lack of financial resources to support pre-planned capital infrastructure replacements, and lack of previous facilities design and adherence to building codes. Bottom line, Army Corps said it would be more expensive to repair the facility than to build a new one. Back to that slide. $743 million to build a new hospital versus repair at $760 million. Some highlights for you, in case you want to read through that. Bottom line, incapable of providing enough space. And the optimal solution to the enhancement of healthcare services on Guam is the construction of a new medical campus on a site to be determined. So Army Corps agreed with us. We don't just need a hospital, we need a medical complex. What happened? Enter Matrix Design Group. You hear this name a lot, the Matrix Report. So the Matrix Group developed the Guam Medical Campus Master Plan that was published in 2022. And basically they took information from our experts here, the Department of Land Management and the Guam Economic Development Authority. And DLM and GEDA proposed 16 sites for a possible hospital. And Matrix did the assessments, they did the scoring. So you can see this quote here, Guam remains a pivotal hub for medical care, but the infrastructure is lacking. So what happened next? They also concluded that co-locating health services on the campus will allow healthcare professionals to produce better professional outcomes and technical developments due to increased co-working and resource sharing. From a citizen standpoint, effective hospital site selection will increase access to health care, minimize rescue times, ease medical anxiety, encourage better overall wellness, and promptly address various medical needs. I find it almost symbolic that we're here tonight at the Hilton, adjacent to EPAL Point. And just minutes before we started, there was an earthquake. And also on my way here, I was experiencing bumper-to-bumper traffic. And of course, there was an ambulance behind me with sirens and lights. And what do you do in that moment besides panic and wish you could evaporate? There's nowhere to go. Also, fun fact, right now, what's happening on Archbishop Loop is there's construction. So it's one way in, one way out. Imagine putting a hospital on that point. But more on that in a little bit. So what happened? We had a top 3. The Matrix took that list of 16 sites that we gave them, and they created a top 3. Eagles Field. Eagles Field was at 102 acres because we know that size matters when we're talking about a growing population. 102 acres. The Guam legislature rejected that site, so we move on. The next 2 contenders was EPAL Point, or the old hospital site at 35 acres, but only 17 acres usable, and Agaga land parcel. But I want to be clear, the Matrix design report erroneously calls Agaga when it's really Agaga, and that's the property that our governor is talking about. So Agaga measures in at 102 acres versus EPAL Point at 35 acres with only 17 acres usable. I took this straight from the Matrix report. If you've not viewed it already, it's available on governor's website. That's governor.guam.gov. So here are the aerial views. Eagles Field, no more Eagles Field. No longer an option. Agaga, which is Agaga, and EPAL Point, former GMH, and adjacent to us here at the Hilton. So we did the who, we did the what, now we're at the where. Governor's vision is to build a medical complex, and we've already concluded that. But where? Agaga, in Barrigada, Mangilao. We call it Barrigada, Mangilao because most of the property rests in Barrigada, but most of the access is from Mangilao, is a crown land. What does that mean for those of us who don't know what crown lands is? There's no original landowners associated to it. 102 acres, I told you about that. Lots of room to grow. The central location increases access, especially for our southern residents. And the Department of Defense has already made plans to expand access along Route 15. So here is a map provided by the Department of Land Management. For those of you in the back, just for reference, here's GPA, GWA, that's the Fidian offices. Here's the Mangilao Golf Course. And here is the proposed property, Agaga, at 102 acres. Here's an aerial view for those of us who don't like to read maps like myself. That is Hawaiian Rock in the corner. That is what 102 acres looks like. So we're still on the where. It's the who, what, where. Our opponents argue the island only needs a hospital. They argue that Timoning is already a medical complex based on the number of providers who've already invested in Timoning. So EPAL Point specifically is where they want to put it in Timoning, but acreage is not large enough. And I told you already about EPAL Point having only 17 acres of usable land. Most of our opponents, they've already made their investment in Timoning. But I wanted you to visualize this because I'm a visual learner. I told you that GMH's existing footprint is about 15.6 acres. This is what 15.6 acres looks like on EPAL Point. There's the cliff line, the Sagin Couture and Chamorro, where our traditional healers are located. Here's us at Hilton, and then the next line. But you can already see this is what GMH's footprint is right now on top of EPAL Point. So 15.6 acres currently is GMH's footprint, and EPAL Point only offers 17 usable acres. Like I was saying, this is getting pretty crowded here. Our opponents want to build a hospital here. We have Sagin Couture and Chamorro, where our traditional healers are. And then Naptan Mananatsa Chamorro Shrine, right there on the corner. And then here's us at Hilton. You can see the tennis courts, so we know that that's the Hilton. In the past 2 weeks, our team had the pleasure of meeting with some geotechnical engineers, and they were able to validate what we've been saying about the fault lines here in the Tumon area, in the Tumaning area. And again, like I said, just before we started, there was an earthquake, and I know you felt it or you got it on your WhatsApp chat. So they talked to us about EPOW Point and the threats that exist at EPOW Point. And that's slope stability, so the ground movement, rockfall, seismic fault, and sinkholes. We're not saying that it's impossible to build at EPOW Point, but we're saying it's going to be a costly expense with a lot of planning. And the higher we build, the more expensive it's going to be. It's going to be very challenging. So these threats would need to be mitigated by slope offset. So we're not building the hospital to the cliff line, engineered walls, and earth retaining structures. Also, if you've ever seen EPOW Point from the ocean side, those are caves. Caves would present challenges to the structural integrity of EPOW Point. Should we build a hospital, which is a lifeline, on that property? So we did the who, what, where, now we're at the when. Unfortunately, we can't make any progress on building a hospital or medical complex until we decide on a location. And so when can we proceed? Well, there's no progress until we secure 8 votes from the Guam legislature to support Bill 184. And at this very week, actually, session started today, Bill 184 wasn't on the session floor. So what can't we do? Without 184, you can't do more. And so without Bill 184, we can't have a cost estimate for a hospital or medical complex. Without Bill 184, we can't get any more commitment for federal funding. Without Bill 184, there are no additional opportunities to attract specialists, no timeline for a veterans clinic, no advancement of locally provided medical services, meaning we're staying at status quo, no increased access to healthcare services for our southern and central residents, again, status quo, and no additional parking for hospital patients, providers, and staff. Because if you've ever been a patient or you've had a loved one who's a patient, you know how difficult it is to find parking. Do more with 184. You can do all these things. And we'll get to that in a little bit. So we did who, what, where, when, now why. Why build a medical complex? Because we need to invest in Guam's future. Governor's vision is to build a medical complex, a medical center of excellence. And I want you to think of these 3 E's. Expand our services, ensure equity, especially for our southern and central residents, and evolve the healthcare profession and workforce to support Guam and our region. Why? Because location matters. Increased access, we talked about that. Improves infrastructure for Barrigada and our Mangilao communities, because we already know that Tumaning has been, there's no more room for any improved infrastructure in Tumaning. Widening of roads along Route 15, I talked about that, increasing access. Also, if we're going to plan to build along Route 15, building a medical complex in this area will take full advantage of their highway improvements, freeing up more DPW funding for our village roads. Because we all know that aside from tax refunds, I think the most complained about thing I hear anecdotally is our roads. And by the way, tax refunds is no longer a problem. Why? Because minutes matter. We all know what it's like. I was telling you about my experience driving here, bumper to bumper traffic and ambulance behind me with the lights and the sirens on. And I didn't know what to do. There was nowhere to go. Supports delivery of comprehensive health care, attracts specialists, multiple access points for entry, may provide reserved lanes for emergency responders and healthcare staff. All of you on the way here experienced that construction along Archbishop Flores Loop. One way in, one way out. Very congested. So less congestion, an estimated 1,000 cars away from Tumaning. Because area size matters. More responsible investment. I told you about GMH already with a footprint of 15.6 acres. EPOW Point with only 17 acres of usable land. And the possibilities in Barrigada, Mangilao, and Agaga is 102 acres. Easier and decreased time of construction. That means when we build, we have room to put the materials for construction. Room for backup utilities with power substations, backup water tanks, and multiple access points, as recommended by utility agencies, further ensuring a more resilient healthcare delivery system. and infrastructure for our people. Essentially, we're building a little city. But also we know that after devastation like that presented to us from Typhoon Mawar, we can bring up our services quicker. I always have to bring this up. More parking for patients and reserved parking for doctors, nurses, and medical staff. Who, what, where, when, why, how? Bill 184. That's the answer. We secure the land, then we can proceed with building a hospital and the rest of the medical complex. I wanted to know that this is Governor's second attempt at building a medical complex. Eagles Field was rejected. And Eagles Field, our opponents argued they wanted to give Eagles Field back to original landowners. That's not the case. DOD has deemed that land, it's no longer deemed excess land. It's actually going now to be used towards a DOD project, possibly a missile defense system. And so no one wins with Eagles Field with what happened, what evolved. Securing land ensures we proceed with securing federal dollars. You can't get a federal grant if you don't have the land. So we can't move on without that. Buying, leasing benefits the Guam Ancestral Lands Commission by providing funding to the land bank for original landowners. This audience may not know what the land bank is, but for those original landowners who will never get their properties back, like think of those people who had property along airport or Retidian or naval bases, they're never going to get their land back. So this gives an opportunity because we'll buy or lease the crown lands, the Barrigada Mangilao lands, putting money into that land bank so we can give that money to our original landowners. How can you help? Hopefully it's not too late to testify in support of Bill 184. Again, it's not been voted on. We need 8 votes by members of the Guam legislature. I want you to call your senators and urge them to pass Bill 184 now that you know a little bit more about it and you have a better understanding of Governor's vision. And you can also sign our online petition. And thank you so much for your time. Again, who, what, where, when, why, and how. As a communicator, that's the only way I know how to present facts. And now with that, I'm going to give the floor to our governor, who really wants to have open discussion with our medical providers. Or actually, she wants me to offer the floor for any questions. Any questions on the slides or any questions for our medical provider or any of our panel here? Don't be shy.
What were site options for number 4 and 5?
4 and 5? I believe. Good evening, sir. I believe number 4 and 5, let me, subject to verification real quick, number 4 and 5, I believe were located up near the Guam Regional Medical GRMC, near the existing hospital.
Any questions from members of our medical community? Anything that needs clarification? Again, we do have on our panel joining our governor tonight, we have Guam Economic Development Authority Administrator. She's really taken the lead on this project. It's Mendiola, Department of Land Management Director. This is Joseph Borja, and the Guam Ancestral Lands Commission. We talked a lot about crown lands and original landowners. And this was the core team that helped identify the 16 potential sites. So any questions? Again, this is an event catered to our medical professionals.
Could I just add also, can you do the slide there with the map, Krystal?
Yes.
Because it's very important to realize the many access to this medical complex in the center of the island. You're right here. And Joe can do more of this, but this is the route here. I think the road is right along here. And what it is, it's Route 15 that comes off from Mangilao, and it goes all the way up to the back road to Anderson. So if you follow that trail, back road to Anderson, you have 2 accesses from Dedido and Jigo. You have the Gajanero Road that comes right off for where the church is, all the way to Route 15. You make a right, and you go right down from Route 15 all the way to Agaga, or Agaga. And then if you take the Macheche Road, which is the road that comes through Laddie Heights from Marine Drive to Laddie Heights. And then you make a right, it comes right back down here too. Why I point that out is people that live in Gigo and Dedido now, if they have an emergency and they have to go to GMH, they have to go through that traffic of Marine Drive. Whereas now, they just cut across from Guerrero or the Macheche Road that takes you straight to Agaga. Coming from the south, you bypass all of Marine Drive because you come through, say, Inalahan, Talufofo, Jotnya, up through Pago Bay, and you just make a right to Mangilao, and then down to Route 15, and you just make a right and right into the Agaga. I also want to point out that Naval Hospital really covers the southern western part of the island. GRMC covers more the northern and the Tamuning area. There's nothing that covers the southern eastern part, this part. Nothing that covers Mangilao, Barrigada, Jotnya, the south. So building it here will give you a triangle kind of access to medical care. The other thing also is most of the access to medical care is in Tamuning, very, very concentrated. If we bring it out here, we then expand those services to more people. And drive time really isn't that much of a difference between GMH, the current GMH, and where the central Agaga is. The concept also of co-locating veterans, public health, mental health, is a concept that is actually a model that is used throughout the United States. So if you go through, say for example, Stanford, and you drive in through Stanford in the entrance, to the left of Stanford, you have your specialty clinics. You have your oncology, your cardiology, your endocrinology, your neurology, and they all feed into the hospital as outpatient specialty clinics. You also, in our vision here, we wanted to co-locate mental health, behavioral health, and wellness center and public health just for convenience for our people. Most of the people that come to GMH that do not have primary care doctors for follow-up are asked to go to public health to make that follow-up appointment. If we had public health right there, they wouldn't have to make another extra effort to get that appointment. It's very crucial because people aren't compliant because it's not convenient for them. Also, mental health. Right now, I know that there is no inpatient care for mental health for medical. And so if we are going to co-locate it with GMH, it's quicker access to have medical care for mental health patients in the hospital and then transferred over to behavioral health and wellness center. The other thing with the Veterans Clinic is very, very, very important. One of the concerns of veterans is the ability of continuity of care. They have doctors that work there, but they have like maybe 2 years, 3 years of rotation. So a veteran will be seeing a doctor, and then the next visit, that doctor won't be there, and now he has to start all over again, his history and so forth, which you lose sometimes information that is critical for continuity of care. So what we're envisioning is if we had a VA center there, we could also be able to share the doctors from the specialty care areas, and not only that, we'd also be able to have more of our local doctors staff the Veterans Clinic, and you then remove the risk of lack of care due to non-continuity of care. So those are the major kinds of thoughts and ideas that went into this decision. This decision wasn't made overnight. This decision was made with thoughtful planning and thoughtful information and thoughtful data. And so with this piece of property, Krystal went over Crown lands. The Eagles Field property was a big controversy because it had original landowners. And unfortunately, the original landowners were given the hope that their land would be returned. Well, their land will never be returned from Eagles Field because the federal government said to me, Governor, you can have this property only if you build a hospital or and a medical complex. If we're not doing that, they're taking it back. So they took it back. It is now probably going to be used for an army base and a missile defense radar system there. So now we've lost that opportunity, and I am working very hard to make sure we do not lose this opportunity. It's very important because it's absolutely correct. Federal government will not go forward with any commitment if there's no site located. Believe me, I have been talking to leaders in Pentagon and DOD because I'm trying to get them to pay for the full cost of this hospital. They're not adverse to the idea. They're not adverse to the idea because my message is you cannot have national security if you do not have human health security. You cannot have national security if you don't have a facility that will take care of both civilian and military people in one united facility. And they are buying in on that. I feel very confident that we will get some funds, grants, to help build the hospital. Why? They've done it before. They built the old hospital that was here in Ipao. They built that. And then, when we needed another hospital, another new hospital, they gave us the money to buy the medical center of the Marianas, $25 million. So it's not an unusual request. And I'm telling you, I'm leveraging everything we can with their whole focus now on Guam being the tip of the spear for national security. I am using that to the best of everything that we can get. We're going to get the hospital funded. I am confident in that. And we'll get infrastructure money for roads. We'll get infrastructure money to harden our utilities. These are all discussions. And the reason I feel confident is this. The Department of Defense has created a task force within their within Pentagon, specifically for Guam. It's called the GIZIC, Guam Infrastructure Community something, GIGSWIC, yes. And what it is its membership are members of every armed service who has responsibility for installation and operations in Guam. That's how important we are. It's headed by the Undersecretary of the Department of Defense. I'm going there next Sunday, again, to knock on their doors, and we're going to meet with them to again have more of a commitment. But they're going to ask me, Governor, do you have a location? And I'm going to have to say, not at this moment. But once we do, we will be able to move quickly in trying to get this constructed hospital. It's really needed. You guys practice there. You guys know the situation there. You know, I think the hospital has great providers, great nurses. I have not heard any complaints about the care that's given there other than the facility. And I think as leaders and as prominent members of the community, we need to stand united to make that voice heard. And I'm looking to the doctors to help us make that message even stronger. You know, once we start once we get the location, we are going to be meeting with the doctors because we are going to get your input on how we can make this facility work for you. You know, there's questions about, well, you know, I'm on call, and if there's an emergency, I have to drive to the hospital, and it's too far away if it's at Agaga. Well, we can deal with that. We can make you comfortable in the hospital when you're on call, because you should really be in the hospital when you're on call. The other thing that I also found out, I was kind of blown away, is primary care physicians do not admit patients in the hospital. I come from the old school of nursing, where you as a patient go see a doctor. The doctor, if you're sick and need the hospital, admits you into the hospital, and your doctor follows you through the course of your illness. It's different now. Now we have hospitalists who take care of you from admission to your discharge. You're admitted, your primary doctor doesn't even come see you. I know this because I was sick in the hospital and my primary doctor never came to see me. I knew this, right? So that was just it was very strange, but apparently that's what the standard of practice is now, because doctors have to take care of the patients in the clinic. They can't just drop their clinic if there's an emergency of their patient admitted into the hospital. And I can understand that, right? So now we have hospitalists. And now I hear we're going to have nocturnologists, or what are they? The nocturnal doctors. That is only going to be doctors that take care of patients from 12 midnight to 7 or 8 in the morning. What are they called?
Nocturnists.
Nocturnists. Nocturnists. We are now going to have 5 OB/GYN that are hospitalists. Before there was nobody. Now there's 5. So the argument of, hey, I have an emergency patient, a pregnant mother that's delivering and I need to get there right on time like this. Well, you have your OB/GYN specialist or hospitalist now to take care of that. So I am, as you can see, I'm very passionate about it, because really it's the best thing for the people of Guam. It's the best thing from the side of the people of Guam. My interest is the interest of everyone, and not just a special group of doctors who oppose it. It has to be seen as a whole public interest for people. And believe me, you guys, Guam is only 30 miles long and 8 to 15 miles wide. Really, nowhere is it that it's far. Nowhere. I mean, when I was meeting with the CEO of a very conglomerate hospital, and I was telling him our complex, and he goes, Governor, well, you know, how long does it take? I said, well, you know, they're complaining because it'll take 20 to 30 minutes. And he said, Governor, doctors here kill for 20 to 30 minutes. They do. You know, just relative comparison. But I am very strong about this. I really am. Because I feel it's the right thing for our people. We need a new hospital. Here's the good things. We need a new hospital, we can build it. Financing, I don't think it's going to be an issue. Location, if we have this, I have money right now from ARP to start this preparation and the planning and the infrastructure and get all that preparatory work out of the way, and then construction. I have an aggressive timeline of about 4 to 5 years. I'm thinking groundbreaking by next year is what I want.
Governor,
need to
Dr.
get the
Tyson has a question.
Yeah, Dr.
Yeah, Governor, I'm also very passionate. I was born and raised here. Actually, I trained in that old hospital, so I'm familiar with that hospital. One of the things, a couple of points I want to make is that, you know, there were studies done to narrow down the sites, lots of planning, Army Corps of Engineers, Matrix, etc. And if they came out with these solutions that indeed this is the best location, you know, I tend to maybe want to think about that before I think about moving somewhere else. I think for those of us that work here in the Muni area, and I'm part of the doctor's clinic, we're going to be around for at least, for me, at least another 4 to 5 years, if not longer. So even if we move the facility and do this complex up there in the Agaga area or whatever that place is called, yeah, even if we do that, those that are practicing here in the Muni area will still have a practice. We really will. And our patients will still come and visit us here if we need to. If we still hold our practice here, we will. If those want to move up there and be part of the structure up there for the, physician offices, that would be ideal too, especially for the new doctors coming in. I also want to state that the hospice, I used to be a hospice GMH, but right now I do admit my own patients. So I'm the only doctor on Guam that has their own private clinic, and when they get admitted, I take care of them. I'm the only one. But I understand the young doctors and where they're coming from. There's a new breed of doctors nowadays, different. When I was a medical student and a practicing physician, I used to admit patients, I used to be on call in the emergency room. We did all these things, and that's what we did as primary care. And I've enjoyed it. The people of Guam have been very good to me. I've been blessed. I've had a good practice, I've had a good career, and I owe that to the people of Guam. One of the things I wanted to ask was, what's the timeline, if indeed this bill goes through? What is the timeline for when this facility will be built?
Thank you for that question, Dr. Taitino. I do believe Mangilao is closer to your home in Sinanya.
But my clinic is here.
I did want to, so there's a number of pre-construction activities that that can occur immediately, and in fact we did get the governor's okay to go ahead and really start looking at some more serious pre-construction activities, and so those are like the environmental types of assessments that need to happen. And so the environmental assessments, we start with that type of pre-construction activity, and then concurrent with that, the design of the building. And the design of the building is expected to take about a year and a half, and then from there, the construction. So there's going to be a number of activities happening concurrently once a site is selected. But even now, before a site is selected, we could potentially do assessments on multiple sites just to kind of keep the ball rolling. In addition, GPA and GWA, we've drafted some memorandums of understanding with them such that the governor can go ahead and request that they begin doing their assessments as far as what the infrastructure investment needs to be for the potential site. The one thing that wasn't discussed in this is it is a phased approach towards building. And so with the phased approach, you have the hospital, Guam Memorial Hospital is the first construction expected to take place on the site. With an aim to replace the number of beds at over here at Guam Memorial Hospital with at least 161 beds, but an eventual target of 300 beds in the total inventory of beds on the island. And so that's a phased approach that we're taking, sir. And so yeah, the pre-construction activities, design, etc., about 2 years. And then we'll start the construction of the hospital itself. In the meantime, I did want to share that there are intermediary plans that we're actively discussing regarding the current GMH, because there's certain issues over at the Guam Memorial Hospital that we can't ignore. And so there's been a number of things that we've been discussing. We've been working with our partners over at we've been talking to GRMC, we've been talking to a number of other parties, private as well as private institutions, concerning how will we, in the event that we need to take parts of GMH offline tomorrow, what will our backup plans be, such that, so that's something that we're working on at the same time. There's a number of different things we're working on, sir.
Thank you, Dr. Tizeno, for that question.
Can I just add, so we also gave $20 million to the hospital when Mel was talking about intermediate kinds of things to make sure that the hospital continues on. We've given $20 million of ARP money to the hospital to fix the basic fiscal structure that needs to be fixed to keep it going for a few more years. Like, for example, the whole envelope of the hospital, meaning the windows, all of that, that's going to be totally changed out. I know roofing has already been addressed, HVAC is being addressed, the electrical system is being addressed. So these are the main things that need to be addressed immediately as a result also of the Army Corps of Engineers findings and recommendations. So we've given them money to do it, and they've given us a list of priorities, and we're saying start that now, so we can refortify the hospital.
So as you can see, Doc, there are short, middle, and long-term goals here. Actually, I had a question for our attendees. Who here is a nurse? Who are nurses? Please raise your hand. Thank you so much. I just wanted to point out, the longer we sat on this slide, it got me thinking I missed an opportunity to boast this. The bottom of the slide, right next to our proposed medical complex, I see ULG, GCC, and GW. A lot of opportunities for educational partnerships to build a greater workforce. We're talking about more exceptional nurses, doctors, lots of opportunities. All I hear from UOG and GCC is our ability to graduate exceptional nurses. That proximity allows for more teaching opportunities. And UOG, GCC, and GW, for our opponents who do say that GEDA Agaga, aka our Barrigada Mangilao facility, is in the middle of nowhere. Yes, Dr. David. Stand by.
Good evening, Governor and healthcare colleagues. And Krystal, that was a very succinct and concise presentation, so thank you. I've been away from Guam. I just got back last week, so I missed the public hearing and the discussions coming here, but I did want to share my perspectives. Over the past 20 years, I've chaired the Guam State Epidemiological Work Group, and my work has been to assess data and to use that data to guide health policy and health program decision-making. So I think this sort of evidence-informed approach is going to be very critical for making this decision as to where to locate our hospital. Healthcare by nature has to be patient-centered. The priority has to be the community. It has to be the people we serve. And a few years ago, with the Department of Public Health, we did a community health assessment process where we looked at all the healthcare facilities on island and plotted them on the map of Guam. And what we found, which should come as no surprise to most of you, is that most of the healthcare services are located in Tamuning, Tumon, and Dededo, which left a very large desert on the map, which was the southern and the central regions. They had very sparse resources, very little in terms of what was available to their communities for healthcare. And so when it comes to future planning for health resilience, we need to cover those gaps. The priority will have to be to close those gaps where access is reduced for certain members of our overall island community. It's about that E that you mentioned, Krystal, equity. What needs to drive this decision is what is most equitable for the least served of our community. I was looking at the at the comments and some of the testimony that was against the location. And I think what struck me was, in many cases, it was more about locating the hospital where already there are so many health services available, which seems to me not very strategic in terms of future thinking. What also struck me was that a lot of the issues raised had to do with the convenience for the physicians and healthcare providers. Respectfully, I think at the end of the day, we need to rethink what is most important for our community. And that has to be closing the gaps to ensure that equity for healthcare services is assured for as many people as possible. And so looking at all of the data and looking at the mapping exercise that we did a few years ago, to me it's very clear that where the governor wants us to go makes the most sense and for the greatest good of the community. And so again, I'll come back to my conclusion, which is this decision needs to be focused on what is patient-centered, what is community-centered, what is in the best interest of those who have the least access to healthcare. So I want to thank you, Governor, and I want to thank your team for really laying out the data and the evidence in this very clear way. And so I hope that's helpful.
Thank you, Dr. Any other questions?
I really didn't want to talk, okay? So Dr. Hua Win brought up before about having community clinics out where these patients that don't have access to it. But you need to have the doctors come to the hospital. And so you need to have the hospital where most of the patients are going to be, okay? So it doesn't make any sense to move the entire hospital to a place for these small communities with less access, okay? You need a community clinic out there, but you don't need to move the hospital there. And another thing you brought up, building the hospital at EPAL Point does not mean we're not going to have parking available. You're saying it's impossible to have parking out there. This is ridiculous. That's going to be part of the planning. So wherever the hospital will be, they will have to consider parking. But you're making it like really crazy and inflammatory. There's not going to be any access to parking. There's not going to be any specialists coming. We're all going to work towards that. But to say it's not going to happen at all, considering EPAL Point, which is one of the top contenders according to the Matrix study, is really ridiculous, okay? It was a good property, okay? So you can't discount that.
Thank you so much for your comments.
I'm Borja. I'm a podiatrist here on Guam for the past 22 years. I moved here when I was 32, and I lived in Santa Rita. That is where I'm from. I worked at GMH and a clinic, Mariana's Foot Care Clinic, for 2 years. My first case at GMH was a trauma case. I got called in the middle of the night, and they said, report to the hospital. So I changed out of pajamas, got into scrubs, and drove to GMH. This is 22 years later. The people that are arguing against it also are people that may be retired by then, including myself. I might stop doing surgery. I've been doing surgery for 22 years. I want this opportunity for a medical complex. We have a team that is willing to build it. I want that for myself. I want that for my 14-year-old son. I want that for my mother, who's 85. GMH took care of my father as he was dying. I took him to a local doctor. My dad's from Santa Rita. Took him to a local doctor and said, would you take care of my dying father? He's getting very frustrated in Naval Hospital. People at GMH, ER, my dad is so stubborn and ornery, and name it, he was it. And he was also a veteran with a drinking problem because he had PTSD. He fought in Vietnam. let's just put that aside. But if you move it to EPAL, or I'm sorry, Agaga, that would not be a problem. I moved from Santa Rita to Tamuning to be closer to the hospital, then found a permanent place in Agaga. But then I said, honey, I want to be near the hospital. I'm getting tired. So he said, okay. So we are going to move in 3 months to Tamuning to be near GMH. And that will be good for me, for my patients, for my family, because it will be down the road from GMH. But when you move to Agaga, not a problem. It's 20 minutes from my Tamuning location where I will be living. Okay, so think about the people that are opposed to this Agaga location. They're older than I am. They're like 10 years older than I am. Think about the future. No, you're not. Excuse me, let's be respectful, okay? This is a calm discussion. You have your views, but let me speak mine. This location will address people that don't have the access. We have people like Dr. Taitano with the Lions Club. We go out to Pneumatic. We screen these patients. I do foot screenings. They take the vitals. People's blood pressures are 200 over 110. My first question to them is, do you have a primary care physician? No, they don't. This was in Pneumatic. Total Foundation, under Dr. Dolores Lee, they go out to Sinahanya. Same picture, blood sugars and blood pressure that are uncontrolled with people that do not have primary care physicians. So we are doing our best to reach these people. Now, we have the opportunity for a Guam medical complex. My father was also treated at Balboa Naval Medical Center. Do you know what a dream that was? They had oncology, they had cardiac, they had primary care medicine, they had a veterans place. Dad was rejected 6 times to get veterans benefit. They approved him in 2 weeks. They gave him everything he needed at Balboa. That was a medical complex. This will be a medical complex, and we have a team willing to build it. I can't tell you how important that is to me. This is my home. This is your home. If we have people willing to build it, build it. Cybersecurity, bioterrorism, the pandemic, viruses that we can't control. My son is sick again. He's 14 years old. He had the flu shot. He had all his visits, but he's sick again. So we have to keep monitoring for fevers. When I go through the ER, all I hear are children crying because they're sick. Viruses. We have the opportunity to work with the military. We have the opportunity to work on these viruses, to be better. We performed so well during the pandemic. We operated on COVID positive people. I can't tell you how proud I am of the hospital, of our government, of our governor. We went through this pandemic with no notice. So now we have RSV, we have people trying to breach security here on Guam. My husband said, be calm, state the facts, and make it short. But I'm sorry, I'm very passionate about this too. I came back for the Chamorro people. I am Chamorro, but I am a military brat. I've been all over the world, and I am for the military helping us to secure this island. So that is my voice, and I don't want anyone else to speak for me. And I hope there will be more support. But my question is, what happens if Bill 184 doesn't pass? My worry is that if that does not pass, what is our next step?
Thank you for your comments. We do always have a plan B, plan C, and sometimes we make them up as we go along. But if Bill 184 fails, we'll just we'll reapproach with another with another plan. And I'm sorry, we'll reapproach again. And I think that there's always there's a number of different other options that we're looking at that are backup options too if Bill 184 doesn't pass.
To add to Mel's points, part of the issue is if in the event, Doc, you were asking what happens if Bill 184 fails, the alternative is Bill 185 may pass, and Bill 185 would limit us to building within the Tumuning footprint, which like I mentioned is EPAL point. So part of that issue is that we will struggle, we expect to struggle with financing. As I said, the geotechnical engineers have already done a desktop assessment for us and have advised us that because of the threats, slope stability, seismic faults, sinkholes, and caverns, we have issues with financing because we have to disclose that to our investors. We have to disclose where we're building. We're talking about a lifeline. This is not a hotel. This is a lifeline for the people of Guam. We cannot afford to build on or near a lifeline. And that's what FEMA might echo as well.
So for those that don't know what Bill 185 is, it's a bill that was sponsored by Senator Chris Barnett. And it's a bill that states that the hospital must be built in Tumuning. Now, think of that very, very closely, because that binds my hands and ties my hands to other possible options that may be better for the people of Guam. So that's what Bill 185 is about. And Krystal is right, it may pass, and if it does, of course, that's not a very good thing for our island. But I just wanted to also add to Mel that there are also private property lands that people have been offering to us to purchase right around the same vicinity. So we, like Mel said, have other options. But like Dr. DeWitt said, the decision has to be what is best for access to the community, and that it's patient-centered, and that this is very key, that it has space for expansion for the future. The old hospital in EPAL was not good for expansion. Our current GMH is not good for expansion. The size is inadequate, the property is inadequate, the footprint is inadequate. And you know, if we have the opportunity for expansion, let's do it. Let's do that, because it's only for more improved quality health care to our island and to our people.
Thank you so much, Governor. Dr. Bez has a question or a comment?
My name is Dr. Bez. I'm a retired internist. But the thing I want to say is that the standard of care in the U.S. is to have specialties in-house now. So the luxury that many specialties have had of being able to stay home and wait, you know, for a call is not the standard of care anymore. The standard of care is to have specialties that are urgently needed, like anesthesiology, like OB, where there are is to have people in-house. So there's been a luxury involved in Guam of people not having to do that. And I think we should aim for the standard of care to build this wonderful medical complex that a lot of places in the States and have said that this is the way to the future, is to have a medical complex, not places all over the community, but in one place where all the services can be. But really the point is the standard of care, and that's what we should be aiming for in this is that people have to be in-house in those specialties. So driving around or getting to the places where you need to be should not be an issue in urgent issues.
Thank you so much, Dr. Bez. We are approaching the 1 hour and a half time. Dr.
Thank you. My name's Dr. Weir. I've lived on Guam now for 34 years. Practiced here. I continue to practice part-time. And I'm also consider myself to be, kind of an amateur historian and also an amateur ecologist. And one thing that has not been brought up and that I think we need to look at seriously are the effects of global warming. If you read your newspaper, and a lot of what I know comes out of the newspaper, the Antarctic ice pack is disintegrating at this point. And when that happens, the Arctic is already disintegrating. The military is concerned about permafrost in the land. And it's been projected that within a few years we're going to have sea levels that rise 10 feet or more. A 10-foot rise in sea level is going to make access to mooning tenuous, to say the least. This means that, right now, Senator Barnett talks about, well, those people in the South don't really, they're still going to drive 30 minutes. Well, the people in Agaga and Sinahani are also going to have to drive that far because instead of coming up Marine Drive, they're going to have to go the back way and come around. And the people in the South, people in Santa Rita are probably going to have to come over Cross Island Road and it's going to be a nightmare. And I think we need to be looking farther ahead than 5 or 10 years. And unfortunately, here in Guam, looking ahead that far is not something that we're very good at. I also am real concerned. I have spent I live in Santa Rita, and I have worked in Irahan and in Santa Rita and Agate for over 3/4 of my time here in Guam. And I think I have some ideas of what healthcare in that part of the island is needed. Unfortunately, it continues to be a healthcare desert, and there are reasons for that. The primary reason being the salary structure and the job descriptions for physicians in public health here on Guam. I just got back from a medical conference, and starting salaries for primary care physicians in the States are about twice what they are here in Guam now. And we wonder why we have trouble getting people to come. It's pretty obvious to me. And unless you have a strong primary care service, I don't care how good your hospital is, you're going to have healthcare problems. And I think there are some issues that we really need to look at in addition to new buildings. We have a great clinic down in the South, but it doesn't have doctors. And building a building and you know, it's like the field of dreams. Unfortunately, building it does not mean they will come. There are other things involved. We do need a more centrally located facility. I would suggest that maybe you should look at teaching. We have some big fields there now that are barely used for sports that would be more than adequate, I think, in size. The infrastructure is there, so you're not looking at the increased costs of major infrastructure. You're going to have to do some road work. You know, obviously, you're going to have to do something. But I think that's a central location. You would have roads coming in from all over, and I think it makes sense. The Agaga, or whatever you want to call it, location it's a long ways away. Having practiced in Rahan and listened to patients complain that, gee, I'm going to get lost going down there, and it's so far to get down there. And these are true stories. There's a lot here that needs to be discussed, and in far as Bill 185, I think we're fortunate that the governor still has a veto power, and I would urge her to use it, because Mooning is, I don't think, a reasonable alternative for a number of reasons.
Thank you so much, Dr. Weir, and thank you for serving the people of Guam for the last 34 years. Dr. Ambrali.
Hi, this is Samir Ambrali, medical oncologist. I practice in Towling, so I won't comment on the location. I'm clearly conflicted. The plan that you have is really an admirable, ambitious plan, and certainly all of us who have studied in the mainland in bigger hospitals would like to see something like that. But we do see quite a bit of obstacles. Now, there has been a general thinking in the medical community about why are we not looking at EPOW versus this new location, and you've seen those presentations on the legislature media. There is also concern about whether it's going to be cheaper to build in EPOW versus cheaper to build in the new location just as a hospital. And irrespective of where you land up and what pieces of those complex you make, I think certainly we all agree we need to make a hospital urgently. And the question is, what can we make at a faster pace or faster, even though you told me that obviously the hospital will go first, and how much of it is going to be funded through the federal government. I do like the idea of having the pharmacy in-house. Certainly, the two public hospitals do not have an inpatient pharmacy, in-house pharmacy for outpatient, and we do see a lot of patients struggle to get their prescriptions when they're discharged. We also have issues about some of our Medicare patients, VA patients getting issues with getting the medications from specialty pharmacies. It's always a struggle for our VA patients to get the coverage on time with the paperwork. Now, the other part about these specialty clinics, definitely we need more specialists in Guam. We know that there is a lot of these specialties we cannot afford to bring in as a full-time because we don't have the volume of those patients to make sure these specialists have maintain their skill levels. So we see some of them come in and they leave in 6 to 12 months because they don't want to lose their skills. So as we talked about, maybe rotating specialists, telemedicine, I think we should have those capabilities in the next future hospital. Definitely room for specialty clinics. I don't know if I agree with the 120 clinics, or I don't know, 120. The number was thrown out in the matrix, but now in terms of the location, obviously I do not agree with the Bill 185. I don't think we should, bind ourselves in a particular location without having to hash out all the issues that are real issues that need to be done. And I believe myself that the issue about location is to be determined by the government, the urban planners. We as medical community can give you opinion about when you build it, what we can put in it and what we need, be it in our EPOW location or the new location. And the other concern that we had talked about, some of my colleagues had talked about, was transport of patients from Tamuning clinics to the new location if it's built up in Mangilao. The basic thing that we need to understand is we have to improve our emergency medical services, bring it up to par with mainland standards. We do not have advanced life support ambulances. We do not have a good public transport system to funnel patients here. So I think if we stand on our EMS, irrespective of if the patients are going from the south to EPA, or if the patients are going from clinics to Agaga location, those will be useful. So in a way, I think irrespective of which location it is, we need a bigger hospital. We need a hospital that can expand. We need services that we do not have, and obviously we would like to be involved in those discussions when you get to a place where you are going to start looking at those services with us. And obviously we are not specialists in hospital management or urban planning, but we can provide whatever things for a local perspective we can in terms of specialties, expertise. Thank you.
Thank you, Dr. Umbrali. I just wanted to make a comment about the transport of emergency patients. That is exactly also my concern. And one of the things that I have advanced is now we have a program through GCC for paramedics. And we just graduated 30 paramedics in this last few months. And these are certified, nationally registered paramedics. And they are riding in the ALS transport. But the goal there is to have a paramedic in every ambulance that we have. And so when I talked to the Guam Fire Department, which is the authority and the agency in charge of it, they're telling me that having 9 ambulances working is very adequate for the load of transport that they make. As a critical care nurse, I have practiced under situations where we worked very closely with the paramedics out there in the field, so that by the time that patient comes into the ER, that patient is stabilized, or that patient has now the life support that they need to be able to, for that period of transport from where the emergency is to the emergency care. So that has always been my agenda also, to provide paramedics program. And we now have a certified paramedics program. So I'm very excited to know that we are now having critical care services out in the field, which is quite important. As you mentioned, if you are transporting patients from the south to the hospital, because there is a time frame whether you transport the patient to Agaga or to Tamuning. There's that period of time. So those are the concerns that we are addressing. And I just want to thank you for your comments and your recommendations of what kinds of things to think about to provide the health care for our people.
Thank you so much, Dr. Umbrali. Dr. Tyson.
Just hello. Yeah, Krystal, the slide that had the caves underneath the cliff line over here, for those of you that want to build a complex on that Ipa Point, I would not work there. To me, that looks so unstable, and if you have another earthquake, it goes down into Hilton or into the sea. There. To me, that would be a very unstable, right? I just want to go ahead and commend the governor for continuing to push this forward. I think for those of us that are working, and I've been working on Guam for 43 years, for those of us that are working on Guam, I think let's go think about the future. Where are we going to be in 10 years, in 20 years? More important, think about our children, our grandchildren. Where are they going to be? You know? That's what we need to do. Think about the future. So I applaud you, Governor, for making this happen. Hopefully this vision becomes a reality, hopefully in the next 5 or 10 years, hopefully in my lifetime too. So thank you.
Dr. Lozama, in the back. Oh, Mariana, sorry. Mariana, you already have one.
I just wanted to speak for the young, new generation of doctors that are a different kind that have been said. So I live up the street. I work at a clinic that's 2 minutes away from the hospital. Building on Ipoh Point would be super convenient for me, and if that was the only thing I cared about, then I would be fighting against the medical complex. I trained at Mayo Clinic. I practiced at a beautiful community hospital in St. Paul, Minnesota. I know what beautiful, well-run hospitals and campuses can look like. And so I fully support this vision for the future that those of us who are in our, I'm 40 now, in our 30s, are going to be practicing in that time frame that will adjust. I think the reason there are so many clinics in Tumuning is because that's where the hospital was built. So that's where the businesses came up. And so there's room for growth in the Mangilao area, and that's great for Mangilao and those people in that village. So it is conflicting for us as providers because we want what's convenient, we want what's going to make our lives balance in this busy job that we have trying to run around the island to take care of the patients. When I first moved to Guam, we were practicing at delivering at Sagwan Minyagu, GRMC, and GMH. And it was crazy, but it was doable, and we actually loved the rush. So that's our business. Our business is the excitement and saving lives and helping people. So I think that we will go where the people are going to be, and we will go where there is room for the complex that is going to be built. A couple comments I just wanted to say in thinking ahead of some other issues. I was thinking transportation, like Samir said, but also I think there needs to be some plans for housing. We have a lot of locums that come to Guam. Those are visiting doctors. We have visiting nurses. I don't know if there's any plans to have physician quarters or build with some companies that the government could own some of the units and rent out. Summer Towers is right there next to GMH, and a lot of the doctors like to live in a new facility like that. So I would recommend that be considered. And also just, you make a nice facility where the doctors can hang out, have whatever they need. That needs to be a discussion. And again, it doesn't need to be about the doctors, but I'm totally with Dr. David and saying it's for the people, where the people can go. But if there's no doctors who are going to come, then there's no one to take care of the patients. Yes, there are hospitalists, but there are specialists on this island who have clinics outside of the hospital that need to be considered also. So I don't know if there's going to be any agreements for our neurosurgeons, our neurologists, our urologists, our oncologists, yeah? our hematologist, yes. So there needs to be some agreement for making it easy for them to have a clinic and then be able to round at the hospital, because that is one of the big concerns for the location and the distance. Because yes, even though it's 20 minutes, and that's great compared to what you would get for in the States, people are on this island because they like shorter commutes. And when we leave our clinic to go take care of a patient in the hospital, then it affects our clinic patients. So that needs to be considered as well.
Thank you, Dr. Cook-Hyun.
So if you look at this is actually using Eagles Field, but this is the concept. So over here are spaces for future medical clinics. And then there's about 40 acres that we reserved for like a commercial arcade with living quarters on top of it. So we have considered all of that. The other consideration we had, I totally agree about making the doctors' lives in the hospital easier and making it more comfortable, because you're absolutely right. And I don't want this to be doctors against us, because that's not how we should be thinking. We should be thinking about how all of us can benefit from it, and we can. For example, right now at the hospital, you guys don't have a really good medical or nursing lounges, right? You don't have a place where you can shut your eyes for a few minutes. You don't have a place where you can warm up your food or cook your food, or a nice kitchen area. Those are things that we are planning in this hospital, because we understand very much that we need to make sure that our doctors and our nurses, our healthcare providers are comfortable, because they're not going to perform to their best capacity. So those are the kinds of things that we're saying when we're going to design this. We will be coming and asking you, what is your input to make your performance and your ability to provide service to our patients much, much more conducive and much, much more convenient. So we've actually thought about all of that, but that's all conceptual. And we're going to, again, make it a much more concrete, definitive once we get the location and start working. The cost that I am saying, the Department of Defense, is $800 million. That's the cost that I'm saying. And we'll see, I will get back to you after my visit in DC next week, because then we're gonna have more serious and more committed discussions about funding and what are the opportunities and the options that are there.
Thank you, Governor. Thank you, Dr. Cook-Hyun. Question from Dr. Lizama.
Yeah, I yielded to my 10 years older colleague, Dr. Titan. But anyway, I've only been practicing Guam for 34 years versus 44 years. But Dr. Titan and I worked together actually, and I'd like to share actually a vision that the late Chris Perez had. This was that vision. And actually, we looked at the Oka Point, and I think went before the legislature, which will bring up a question with regards to Oka Point. Is it under Chamorro Land Trust, or is it a Crown land, as they call it, or is it? It's under Chamorro Land Trust, right? Because I think at that point, Henry C. was our partner, and we were presenting, a complex there, and we were told that it's not available. So, there are some challenges to building, in Tamuning, but, and so the late Dr. Perez in the group of the Doctors Clinic looked at this property, I think, through the University of Guam, and we looked at having a medical center, a nursing center, like you said, Governor. So this has actually been looked at as a property, for a medical complex. Now, I'm sorry, Governor, I have to say welcome to my previous world, where I was looking to building a surgery center at GMH, and of course I was challenged with everybody in the legislature regarding, if the hospital can't collect money on the current, operations, how we're going to expand and get more, money, if we can't have the right management. There's so many questions, Fortunately, it's not the major question that's coming up in the discussions about where to build the hospital, but certainly it was during our time. When I was the medical director, as I was looking at, that if the 3 M's make up, 40 to 60% of our population, how we're going to pay for expansion of our services. But, the governor is the governor, and the governor has a right to make a decision about what is in the best interest of the island. And this is her vision. I respect this vision, and I support this vision. Okay, and the comments about the hospital. Let's not spread false practices of the hospital. The hospital is safe to take care of anybody, not having to wait for somebody to come from outside. Okay, Dr. Jerry Castro doesn't live near the hospital. Okay, but we have people that take care of them and patients with ENT emergencies in the emergency room. We're looking toward, hospitalist-based hospital, like Dr. Bess said. So I agree with Dr. Cook. Yes, I was hoping we do need a housing complex, because our local people need to be housed next to the hospital. But to come there, yes, when we started this contract of hospitalists, the expectation was doctors need to be in the hospital. Okay, doctors need to be in the hospital, and they need to close their practice for the day. They're getting paid for the day. Now a lot of doctors may complain about that because they're not getting paid enough, but at the same time, that's the concept behind having a hospitalist. So, yes, Dr. Titan provides care. I've chosen not to provide care because to me it's unsafe for me to be taking care of a patient while I'm indebted over the phone when they're intermittent. Okay, so I yield to the standard of care is the hospitalist, and we're recruiting. And I would tell Dr. Weir that if we can recruit more hospitalists, we can include outpatient services as part of the hospitalist recruitment. Okay, and my CEO is looking at that in with regards to HRSA, loan forgiveness program. So we're looking at how we're going to provide a comprehensive care within the hospital complex. Now, at the same time, if we have public health next door, it'd be easier to have our hospitalists, work there as part of their responsibility. They don't have to be 2 weeks on, 2 weeks off. They could be 2 weeks on in the hospital, and the next time they work outpatient clinic. I mean, again, I look at my sister's running Saipan. She's got the hospital, the outpatient clinic, and in the hospital compound and everything there, and so it's nice to have a hospital with all the services around that the area. We are behind in capturing post-hospital follow-ups, whether it's public health or community physicians. We are behind in again trying to measure get a measure of success in our discharge and readmissions, because of issues regarding outpatient follow-up, and we can be better at capturing patients if a public health clinic is right in the hospital compound. So I agree with the concept of having a complex. I think it's a vision for Guam, it's a vision for the people of Guam like the visit, and we really need to be thinking about a vision for the people of Guam. I'm sorry for my colleagues who feel that they have to be the main focus of this hospital. It's not. It's for the people of Guam. And, you know, again, nobody is going to have a problem if, how many times I've been in the hospital, how many times is this? Any OB in the hospital, please come to the OB department, because the OB outside is not coming in timely manner. Our nurses are trained to deliver babies, you know, right? Dr. Bell. So, you know, I know Dr. Shea, I mean, I can't comment on Shea because he's a great doctor and he's a great with his patients, but, you know, I understand that, but he's one of many providers in the community, you know, and I think this is good to have for the care of the people of Guam. This concept is good for, you know, again, providing one-stop center of care. And with Dr. Ambrali's comment, I think if we centralize care, we may have a better numbers into recruiting for specialized care, you know, because then we're centralizing all the care versus, you know, individual physicians are sending them to wherever they want, you know, whether off island or whatever. So, you know, we're going to get there, but, you know, our vision has to be bigger than what it is now, and we need to think, you know, again, to the future of Guam. So, anyway, thank you for that. But and again, I hope the legislature, you know, see that this vision is really about expanding healthcare for Guam, not necessarily just for building a new hospital. Thank you.
We are approaching the 2-hour mark. I want to wrap up the questions.
Good evening, everybody. My name is Akoma. I run the Health Family Medicine Clinic. I have 2 questions. First is concerning the VA clinic. Do we have any commitment from the Veteran Affairs or VHA that they will participate in this hospital when it is built, and what will be their contribution? Because if it will be the wing and the VA is not moving into it, how are we going to staff it? How are we going to be paid for the services provided when we staff it? That's one. Secondly, I believe that the best should not get in the way of the good. Right? Our governor has 2 more years in her tenure. Which is the easiest way to do now? Because time is of an essence. GMH as it is right now, by all means, could be condemned. Because there's mold, there's problem in there, there's a lot of complaint. What can we start now? What is the feasibility study? Have we done any comparative analysis in cost between bringing utilities to Agaga versus utilities existing in tuning? What will be the cost difference to building up? Like I used to live in summer towers, right? There are 2 levels of basement that park more than 1,200 cars. So building down for parking and building up to contain everything, what will be the cost compared to the spread out in the bigger location? So have we made that analysis? So those are my 2 questions.
Well, first off, thank you, Dr. Akoma, for those questions. And also, Dr. Akoma is one of our Veterans of the Year, just recognized this past Veterans Day. So thank you again for your service. 2-part question first.
So with the veterans, we have been in constant communication with the Veterans Affairs. And in one of my trips last year, I met with the Secretary of Veterans Affairs. And as you know, the Deputy Secretary of Veterans Affairs was out here. And they both agree that something needs to be done to provide more services to the veterans here. I approached him about this veterans clinic. He is very accepting of that. So whether they themselves build it or we build it and they lease it, they did say that there is something that needs to be done for the veterans. That's one. I will also expand that discussion when I go to DC, because we're going to be meeting. The other one about the cost analysis comparison. There hasn't been a detailed cost analysis comparison, but the Guam Waterworks has told me that the infrastructure right now at the EPAL point is old and cannot even be relied on. Don't even think about using it. So you'd have to totally dig it out. And the other concern that he had, because of the issues of pressure there, that is going to impact the surrounding residents in terms of water distribution to them. So there's going to be added costs to expand and to do more boosting for water supply there. But I have not made any cost analysis comparison. I do know that the engineers are saying that in order for the hospital to be built up and for a foundation that needs to hold that, they would have to pound into the dirt more, and they're concerned about the caves underneath there that would not hold the structure. They did say that it's not impossible to build, but it will be much, much costly because of the added and complicated, intricate engineering work that they would have to do to support whatever the sloping and the caves.
Well, the reason why I asked is I used to live in San Antonio, and I worked at Brook Army Medical Center. I drove 1 hour one way to work every day, and it wasn't a problem. So nowhere in Guam takes you 1 hour to drive. So it doesn't matter where the hospital is. It could be Melissa, right? People will get there. But the thing is, what can we do now? Because we can be in this planning for another 5 years, 10 years, and the hospital is not good. Your tenure expires in 2 years, and the new governor doesn't make it a priority. Then what happens?
So that's why I'm very urgent. And once we get the location, we can start right away with the preparatory work. In fact, Mel was saying that we can start that now with NEPA environmental assessment, laying out the plans for infrastructure, doing all that kind of earthwork preparation, so that my goal is to have at least a groundbreaking by the end of next year. And it's a pretty aggressive goal, but you know, you can't say, oh, I'm going to have a groundbreaking in 4 years, because people aren't going to act fast. But if you make the goal a little bit shorter in time, people will respond. So that's been my experience.
Jesus Masi, Dr. Burke, you look like you have a comment or a question. And this will wrap up today's event because we have approached the 2-hour mark.
I'm also one of the younger physicians. Just started. Well, in comparison to my colleagues, I'm somewhere in between, sort of towards the younger end, I would say. Only having been practicing here for about 30 years. And so I'm not going to say much, except I think that looking at things like Bill 185 is something we can't afford to do, which is, in our community, is to live a narrative, to say it has to be EPOP, period, end of discussion, and that's it. And I will fight to the death for EPOP. We can't say, no, it needs to be Mangilao because I say it should be. We can't do that. And I'm so strongly encouraged and would ask others to join me in just listening. You may start with your own opinion. What Dr. Brawley said, what about, advanced life support? Oh yeah, good point. If we put it up there, that's going to be an issue. That's a very good point. Well, what about if we need more parking? Can we go down? Oh wait, we got those caves. I hadn't thought about that, right? These become things that if we just listen, we can make an informed decision. And that's what we want, right, is to make an informed decision. And there are, in every procedure that I do, in television, there are risks, benefits, and alternatives. And then you leave it to, in this case, the people of Guam or their elected official. and turning it to saying, no, it must be, that's anti-democratic, in my opinion, saying it has to be an EPAL because 15 members sitting of the legislature, yes, they are elected members, but that's 15 people, should not be making that decision. It needs to be, people have to listen. And I also am really strongly encouraged by your reaction. And I think others should listen to the way the governor responded and said, what if it's not going to be up there? And she said, hey, I'm going to paraphrase it. Well, then we'll deal with what we have. And I will get behind, I'm not going to express my opinion because this lady over here told me not to. That's the head of the health profession licensing office. As the chair of the Guam Board of Medical Examiners, I'm not supposed to express my opinion too strongly with regard to political things that affect people. So I'm not going to. What I am going to say is whatever decision is made, I want to be part of the team that helps the governor make it a reality. Whether that is a new medical campus in Mangilao, Barrigada, or here. Call on me, and I hope everybody, whether that what you wanted happens or not, is to then quickly turn the tide and say, we need to support the governor in building this, whatever it is. And the second thing, though, that I will say is, no matter how you're approaching this, that you can't really disagree with the fact, I've raised 4 children here, still raising some, at 29, it's not, still raising them, they need to be our focus. They need to be, not what's best for me, right? Is what's best for my kids, what's best for the future of Guam. God, I think at least 10 years, but more likely is 30 years from now, will we be sitting here saying the best decision was to put the hospital here or to build a medical campus there? And that's for you all, for everyone in our community to think about 30 years from now, what would have been the right decision, right? But I'm not going to give my opinion. I'm going to say whatever happens, just please throw your support behind it, bring your expertise, and that's it. And I'm actually extraordinarily encouraged by the reasonable approach that everybody's having tonight, right? And yeah, it is a passionate thing. And inside, I have really strong passion about this, but I'm just happy that people are bringing up the issues and saying we'll solve them. Somehow we will solve them. Whether it's parking at EPAL if it's here, or whether it's how do you save people's lives when they're in the clinic here. And I started thinking, maybe put an ambulance at the fire station in Tamuning and keep it there permanently. That's where it sits. You start thinking about these problems. Once the decision is made, we all get together and say, what are the problems and how do we solve them? Right? That's it for me.
Thank you so much, Dr. Burch. I think you summarized today's event best, and we'll take that as our closing remarks. Again, thank you for your time. We've approached the 2-hour mark. Did you want to?
I have to say one thing.
Good evening, everybody. Thank you, Governor, for this forum, and Ms. Krystal for this piecemealing briefing. I wanted to add that I work in a military facility, and one of the things that we always look at is strategic planning, right? And so when you look at the mapping, and if you are, let's just say, we all know, right, we have military installations throughout Guam, and we are a potential or target when it comes to our adversaries. So what happens in the event that there is island-wide mass casualty? How do we respond to that? So if you look, if we were planted and went back to EPAL Point, can you imagine the congestion in responding and time that it's going to take to respond and meet the needs for our people, to include our military, if needed, right? But when you're sitting at GEDA, at a cow? Agaga. There's so much room for movement, right? There's no constriction, there's no congestion, and then there's potential, you know, when we talk about expansion, you also got to think about, like, maybe we need to build a tent city in that area. So just food for thought, right? And I just wanted to share that. Thank you.
Thank you.
Can I just add that in that concept, there's room for a helipad
There's room for a helipad there. And the way that we established the concept is that in that parking lot area, there's going to be underground piping already for oxygen and electricity, so that if there is the need for a hospital tent, it's just all right there. So those were some of the negotiations that we made with the military when we were doing the Eagles Field. But it doesn't mean that we can't move on forward, especially if they're going to fund it. Yeah.
Thank you so much again. Your time is so valuable, and this open dialogue was very valuable. I ask that you leave here and you dare to be visionary and join us in this vision and build a medical complex. Jesus Mas, you have a great